Hey guys, this is Nate with Vegan for Your Life. We're going to continue our series on diabetes today. So this is part 2. Last time we talked a little bit about how the American Diabetic Association recommends an increase in whole grains, fruits, and vegetables for a healthy meal plan for a diabetic or somebody that's concerned about getting diabetes. I want to talk a little bit today about some of the studies that confirm that, and we'll jump right into it. The first study I'm going to point out was done, in 2004, and it says the objective of the study was to examine the relationship between carbohydrate-related dietary factors, insulin resistance, and the prevalence of the metabolic syndrome, which diabetes is included in that. So what they said was total carbohydrate, dietary fiber, fruit fiber, vegetable fiber, legume fiber, glycemic load, and refined grain intakes were not associated with the prevalence of the metabolic syndrome or diabetes. So carbohydrates, fruit fiber, vegetable fiber, legume fiber, glycemic load, even refined grains were not associated with diabetes at all. They went on to say that whole grain intake, largely attributed to cereal fiber, is inversely associated with insulin resistance and a lower prevalence of the metabolic syndrome. Dietary glycemic index is positively associated with insulin resistance, eating foods with large amounts of sugar in them, and the prevalence of the metabolic syndrome. So given that both a high cereal fiber content and a lower glycemic index are attributed with whole grain foods, so they're low in glycemic load, so sugar, and they're also high in fiber. Because of that, it says that recommendations to increase whole grain intake may reduce the risk of developing the metabolic syndrome or diabetes. So diets high in whole grains and complex carbs are better at lowering insulin resistance. So that was a pretty cool study. The second study that I want to mention, and I'll put the references at the end of this. The second study I want to mention is, this was done in 2006, fruit and vegetable intake and the metabolic syndrome, American Journal of Clinical Nutrition. They evaluated the relationship between fruit and vegetable intake and C-reactive protein, CRP concentrations, and the prevalence of the metabolic syndrome. So fruit and vegetable intakes were assessed with the use of a validated semi-quantitative food frequency questionnaire and a cross-sectional study of 486 Turaney female teachers ages 40 to 60. So they did a big food questionnaire to find out the relationship here between fruits and vegetable intake and diabetes, essentially. Persons in the highest quantile of fruit intake, so the people that ate the most fruit, had a 34% lower chance of having the metabolic syndrome. And then, people in the highest vegetable intake had a 30% lower chance of having the metabolic syndrome. So if you eat a lot of fruit, the more fruit these women ate, these teachers, 34% of the women that ate the most fruit had the least amount of diabetes, metabolic syndrome stuff, insulin resistance, all of that. The ones that ate the most vegetables, there was a 30% decrease, lower chance of having diabetes and insulin resistance. So the conclusion that they came to was the higher intake of fruits and vegetables are associated with a lower risk of the metabolic syndrome. Lower risk may be the result of lower CRP, that's the C-reactive protein concentrations. These findings support current dietary recommendations to increase daily intake of fruits and vegetables as a primary preventative measure against cardiovascular disease. So increasing your fruits and vegetables is one of the best things you can do to avoid diabetes, cardiovascular disease, insulin resistance, all of those diseases that fall into that metabolic syndrome category. Pretty convincing evidence, and like I said, this is 2 studies out of a whole bunch of studies that I looked at. I just wanted to point out a couple of them, just so you can see a little bit of the science behind why the American Diabetic Association recommends eating more whole grains, more fruits, and more vegetables, and a low-fat diet, which is exactly what we're promoting. So, hope you guys like this, and stay tuned for the next video in this series on diabetes.